As Lisa mentioned, my name is Chris Williams. I'm a SAK TTA site liaison as well as a member of our webinar team here at RTI International. I wanted to thank everybody for attending today. As Lisa said, if you guys have questions throughout the presentation, feel free to type them in the chat pod and we'll address them. We're excited about today's webinar regarding evidence tracking. We have 4 presenters from three different states, and we're very excited about it. We think it's going to be a very good and very knowledgeable set of presentations. So like I said, if you guys have questions, feel free to type them. We'll shoot to get those addressed at the end of each presentation. But then if not, we'll address them towards the end of the presentation as a whole. Without further ado, I will go through our presenters here. First, we will have Matthew Gamet. Matthew is the Laboratory System Director for Idaho State Police Forensic Services. He serves and participates on many committees and working groups, including being the current president of the American Society of Crime Laboratory Directors, also known as ASCLD. In addition, he also led the development team for Idaho kit tracking software that you will be hearing about today. After Matthew, we will have Susan Lehman. Susan is the SAK program coordinator for the Portland Police Bureau in Oregon. Prior to this position, she worked in the sex crimes unit for 6 years, specializing in advocacy. She also worked for 17 years in the records division. Susan took her knowledge from the records division and years of reading thousands of police reports to help design the Sexual Assault Management Systems database. After Susan, we will have both John Hillman and Nicole Minus from Washington. John Hillman is an Assistant Attorney General in the Criminal Justice Division of the Washington State Attorney General's Office, where he prosecutes all manner of crime, including sexual assaults. John has been a prosecutor in Washington since 1995. Prior to joining the Attorney General's Office, John was a Deputy Prosecuting Attorney for Pierce County from 1995 to 2007, where he spent time specializing in sexual assault cases and crimes against children. After John, also from Washington, we will have Nicole Minus. Nicole works at the Washington State Patrol as the Sexual Assault Kit Tracking System Technical Program Manager. After a successful pilot, she is currently managing the implementation and training of the system statewide. Again, thank you all for attending, and thank you presenters for taking the time to share your systems with all of our attendees today. As I said, leading off today will be Matthew Gamet from Idaho. So Matthew, take it away.
Thank you very much. I think it's important for us, first of all, to discuss that each state and each location is going to have different state laws, and they will definitely have different policies that they're dealing with. So I want to be very clear at the outset of my presentation that we were dealing with a set of state laws, and we designed our system to be specific to those state laws. So your circumstances may be different, and I would ask you to look into that going into this process, because what works in Idaho may not work other places. What I hope to do in this presentation is talk to you about some of the lessons learned, some of the implementation that we did, the value that we feel in collaboration, and also the software tool that we developed to do sexual assault kit tracking in Idaho. So I want to start out by talking about our state laws. We do have several state laws that govern this. We have been instrumental in helping the legislature to understand this issue. The state lab has been very engaged with a number of stakeholders here in state to bring partners together to the table. These groups that we've brought together have been instrumental in helping develop these state laws. So the biggest 2 state laws that we have are that we are required to track sexual assault kits in our state. We were required to do an audit of all sexual assault kits that existed on law enforcement shelves, which we call previously unsubmitted kits. We're not referring to them as backlogged kits because we didn't have them. They were on law enforcement shelves for the most part in our state. So we have those laws that govern that we have to bring those kits into the state lab and process them within a certain amount of time. But we also have laws that now dictate how long those kits need to be kept. There are 4 reasons, and really it boils down to 3 reasons in our state why a kit would not be submitted to the state lab or any lab to be tested forensically. One is if the victim declines to have their kit tested. A second one would be if law enforcement determines no crime was committed, and there's another permutation of that, which is that if they are investigating it and come to that conclusion later on. So in either of those cases, in any of the cases, that has to be signed off by a prosecutor in our state. They have to agree with the law enforcement's decision, or those kits are sent in and processed. So the first thing that we did an audit, and that was driven by the state crime lab. We had no legislative authority to do that, and we found that there was a very low response rate from law enforcement. We don't have a law that they have to respond to us. We were just interested in gaining and obtaining the information. We then went back after a lot of work with the state legislature, and it was legislatively mandated, and we did a second audit. This time we did get 100% compliance of our local and other law enforcement agencies in the state, so they provided a lot of data to us. I will tell you that this audit became critical in the rest of the process. If you hope to obtain information, you need to do an audit, and you need to do an audit well. And I'll talk a little bit more about some lessons we learned in the audit specifically. But I will tell you that without putting boots on the ground at some of these local agencies, we found that the data was largely unreliable. They have a huge lift to send officers and detectives back into their evidence rooms and other spaces, review reports and those kind of things, and it's very difficult for them to commit those kind of resources. So us helping them, putting boots on the ground with them, really has made a huge difference. We developed a collaborative team, and we had everybody involved that we could think of might even touch this space. So we developed a group called SAK, the Idaho Sexual Assault Kit Initiative. What this group was anyone from prosecutors, agents of the court, the lab, our CODIS administrator. We brought in sexual assault nurse examiners, SART coordinators. We brought in victim advocates. Anyone we could think of that would participate in this space would touch a kit through the process. We brought them into the meeting. So at this point, we have about 30 collaborators working on this project. This group developed policies and procedures. They're looking at the statewide sexual assault collection policy and procedure in our state right now. They developed great policies. We also have legislators on this committee that come and meet with us, and then they take those good policies that have largely been agreed to by this group, and they work them into applicable state laws. It's been a very helpful collaboration. It also led to the nexus for having kit tracking software. Now, we developed our software in-house. We developed it here at the Idaho State Police. We have resources, IT resources that are phenomenal, and we have web programmers that specifically worked on this program. We had a team of programmers that were working on this project for 2 to 3 months. 4 of them were working on this project. They are extremely talented. Not only did they work with us, but we had experience with them in the past developing other programs where we were able to communicate with them in a really nice way about keeping things simple, making sure that the user interfaces were simple, and they understood what we were trying to accomplish with this project. We also have them in-house, so we met in person rather than on phone or other kind of impersonal communication mechanisms. We learned the importance of dedicating a full-time person or people to this project. So we have a person that follows up full-time. They were legislatively given to us, and she calls constantly every day to follow up with law enforcement, prosecuting attorneys, medical people, to make sure that this process is going well and that things are followed up on that are not going well. We have a state of about 1.5 million people. We collect about 500 kits a year. So I do think that that's probably scalable to other states in how many people you need to have. It is a full-time job for her in our state. It becomes critical that you control your kit intake, or at least that you know what your kit intake is to the process. I don't know how a state that relies on manufacturers producing multiple kits or relies on the hospitals or someone else doing the procurement I don't know how you know what the intake is. I've had a lot of discussions with various states that use different models, and I do think the model is becoming that one state entity or organization takes accountability for purchasing the kits and putting them into the process. It becomes a little bit better fiscally. You can get a better purchase price, and then I also think that the most benefit there is that you know exactly what's going into your process, and you can put them into the system early on and track them all the way through the process. We say that you find a sweet spot to mandate what happens in any part of this process. We've found that our legislation is 30 days for law enforcement to get kits into the laboratory, 90 days for the laboratory to process those. Now, there are no punishments in the state law, at least here, for people that are not meeting those mandates, but it is important to really take a look at those. 30 days for law enforcement is pretty aggressive for them to have them into the lab if we hope to have any investigative information on those, information for CODIS, for example. We're finding that it's generally taking law enforcement about 60 days to get some of that introductory information and also collect reference samples from the applicable people. So I would recommend between 30 and 60 days for that. But the nice thing for the laboratory in building something into that legislation was that it does give us the ability to go back and ask for additional resources when those are needed. There is no punishment for us in not meeting that other than I need to make a report to the state legislature that we're not meeting that. When we're talking about the legislation itself, again, it's really important to look at what will the policy say about the required contributions from law enforcement, prosecuting attorneys, and especially medical participants. Generally, these medical entities are not part of a state system or a state funding system. They're generally private entities or organizations. It has become very difficult for us in our state to mandate them to do anything, mandate a certain turnaround time for them to put information into the kit tracking system or to move kits along in the process. We're working with them collaboratively, but there is no stick. There's just a carrot that we have to work with those medical providers. That will become important in your considerations. It's also very important to understand and have a plan to deal with your older kits. Most of us, I would say most of the entities, do have older kits, those previously unsubmitted kits still sitting on law enforcement shelves. We have now a 55-year retention on most of our kits per state law. So we thought it was important now to gather as much information as we could on those kits, put them into our kit tracking system, and then track them over that 55-year retention. Many of you I know have tens of thousands of these kits sitting in your state, and that will be a monumental lift if that's the policy decision. If you do decide to go forward with date-forward information only, then how are you going to deal with all those kits that have been previously unsubmitted to your lab or have been processed at your lab and are now still sitting on those law enforcement shelves for an undetermined period of time? During the development of this, I want to be clear that you have to have IT resources if you're going to do this in-house. We had those. We had our own servers. We had access to our own servers. Our own web programmers, they had access to the servers. So it really worked for us. If you don't have those level of resources, you have to consider some kind of commercial product, or maybe there's a contract vendor that you can use to do this. I know a lot of states have IT resources outside of their department, and that becomes a little bit problematic when you can't directly access or influence those resources. So again, it worked for us. It may not work for you. Just consider what you might need. The benefit to us and the reason why we decided to go with our own in-house is we paid literally nothing for the development of this other than the salaries that we were already paying to our employees and staff. We have no ongoing costs for this system. And it really works for us. We put a little bit of time each year, but again, those resources are already dedicated to our department, so it works. We had lots of lab involvement. Myself, our DNA technical leader, our laboratory managers, CODIS manager, all sat in on the development of this and directly instructed the IT resources how this should be built. But we also brought in a lot of collaborators. We brought in any stakeholder we could think that might touch this or be involved in any way. We had 30 to 40 people from various aspects of our community looking at this from all perspectives. We had a lot of feedback from them. We let them play with the system. We let them test it and try it. We looked at privacy issues. So we were very concerned. We get hacking attempts constantly as a state agency. And we didn't want anything to be hacked that could be personally identifying information to a victim. So we don't put in any information about a victim in the system. There's no name, social security number, email address, phone number. When we were considering login or not login, we decided to go with a not login system so that the victims didn't have to provide even an identifier number to get into the system. So you can't get any information on a victim. You might be able to see when the crime was committed, what hospital it came from, those sort of details, but never associated with the victim. We also designed it with a very simple user interface. We didn't want to do a whole lot of training on this system, so we were hoping that most people that knew how to run a computer could easily interface with this system. During the development, we decided that we needed some victim declination forms to actually decline if they didn't want their kit tested, and that became really important as well. We had those forms in the kit, and that became a problem because the nurses were having those kits declinations signed, and they really didn't intend to sign a declination. They were just signing all the kit paperwork. So we had to solve that and take those declinations out of the kit. We also looked at what the victim survivor notifications were required by law. We wanted to give them information, but not give them stuff that was going to confuse them. So we provided all the information in an easy format. We did training, live in-person webinars. We also archived our YouTube videos. There's also value in having a full-time person to run live training on the web. We valued the face time at the agencies and went in person to train them. It is important to gain agency contact information when you do an audit so that they can be part of this training process as well, and there is someone that's required to provide information on their agency in this system. There's always constant follow-up and verification with agencies, so obtaining that contact is really important. You see on this slide, and I think you can click on them if you want to, but these will be provided after. This is an example of what we did to train users on the various aspects of the program. These are still up. You can look at them. You're welcome to peruse them when you get the presentation. This slide, I like it. I like Abe Lincoln. I like his leadership style. Spend the time in collaboration and spend the time preparing before you develop your system. It will pay huge dividends. Here's the link to our kit tracking system. It is on our open website. You can go and look at it at any time. The public can see it on our public-facing website. I want to focus on what some of the users see. So this is the law enforcement view that you can see. This becomes critical because we found that a lot of our law enforcement agencies had no idea how many kits they had, what status they were in, and this really became a LIM system, a laboratory information management system, or a police evidence tracking system perhaps for their agency. You can see that they really have 5 different views. There's kits that are incoming, there's kits that are pending submission to the lab, so incoming from the medical place, and then pending submission to the lab, kits that are at the lab, kits that are analyzed, they've already been to the lab, and then they also have, in our state again, kits that don't meet the criteria. So they can use this at any point to provide information to the media or any of their other stakeholders on how many kits they have and in what areas they are. This is a very simple user interface, again, just for them to do the steps that they need to do, see the information that they need to see, but not overcomplicate it. The next view I'll have you look at is the organization management. It was critical for us that they manage their own users. We didn't want to be involved. I didn't want to have 4 admin staff at the state police trying to manage the organizational users. So there's a 2-part verification system for the users where they're given a pass key. So the agency sends out the pass key to those who they want to have access. They then log in using the pass key, and it asks the manager for the organization to accept them as a user. They can provide contact information, they can designate who the organizational contacts are, and they also, if you get that developed, you can use LDAP users if you're familiar with that technology to manage your users. So lots of things that have been developed in to help the organization manage their own users. They can delete them as they leave the agency, and we, most importantly, don't have to do anything to manage their users. They know that it's their responsibility to add and delete people when they join and leave the organization. As we talk about the laboratory, the system is designed, we are the only laboratory in our state that does DNA. So we're the main contributor to this system. However, we have designed it so that you can have multiple laboratories looking at information for their organization. So it's not just designed for our state, it is applicable to other states. I will also say that when we're looking at this in the lab, it is a little bit duplicative of our LIMS system, but it's still very helpful because it allows us specifically to focus on sexual assault kit issues. And when I want to pull information specific to sexual assault kit tracking, I have the metrics in this system to do so. We also require a prosecutor review. And so we have a prosecution view in the system. Again, they manage their own users, but they're making a declination. If the law enforcement agency is not sending the kit into the lab, then they have to make a declination and agree with it. We've worked on this wording expressly with the prosecutors associations to make sure it's legally what they want to see, and that has been another part. Some concern came up there, so I can talk to you more offline if you're interested about this process. There's a medical view. This is something a hospital or a clinic would see when they're collecting the data. Again, very simple. They have a kit number. They designate when the kit was collected, what law enforcement agency it's going to. It's a push and a pull system. So they push it to law enforcement pulls it from them, and then everybody knows that the kit has been transferred. The public view is also very simple. The public view just consists of some information there on the chain of custody. We don't refer to it as an official chain of custody, but that's what it really is. If the information is applicable, then it shows up, and if it's not, then it doesn't. So here I'm showing that there is a DNA database entry and a DNA database hit. If it doesn't have either of those, then they won't show up. That's so as not to confuse the public on what's happened in this case. If they see an entry date and there's no date there, then they're going to be calling us or law enforcement wondering why that field is not filled. So you can see again, it just tracks from the lab where we put those kits into the process all the way through the collection, the law enforcement agency, to the laboratory, back to the law enforcement agency. And again, in our state, that's where they're located longer term. The law enforcement agencies are required to keep them according to the state law. I'll briefly touch on the reports that are available. The main thing is we track the steps and the timeline for each one. How long did it take for the hospital to get it to law enforcement? How long did it take for law enforcement to get it to us? We track all of our completed kits so we can provide that to agencies and the legislature. The kit statistics are given to the legislature and the stakeholders, and they constantly ask for these reports. So we're finding that we're legislatively mandated to give them a yearly report, but realistically we're giving these reports on a monthly basis at this point. The legislature is very interested in the data that we're gathering from this system. They use it to give us resources to find out how many new DNA scientists we're going to be looking at for the next year and things like that. We also use it to find out if law enforcement is delaying the investigations on these cases, and then we follow up with them if we're not seeing the kits moving in the system. We also track the unused kits. There's two benefits here. One is that we don't waste kits. When we were not tracking them, we figured that we were probably wasting about 50% of the kits that either expired or were repurposed before they were ever used as sexual assault kits. The other benefit is that we don't run out. We have talked to other states that have asked us for kits because they were running out because their collections were increasing so much. So we know exactly how many kits we have in inventory and where we have other kits that we might be able to have one hospital send them to another kits or to another hospital or clinic. We know exactly how many kits are where and when they expire. We can also repurpose kits if we need to and change the expiration dates on certain components if certain components expire. It is important for the legislature to know and your other funding bodies to know what resources you need, and we really use it for that. We look at questionable events when things don't make sense, when date transfers aren't looking correctly, and then we do administratively fix those with the agency. There is a tracking system, an auditing system on the back end so that we know exactly what changes are being made administratively. And then we do have annual reports. They're available on our website, which is available to you. We have 2 years of reports there now, and you can look and see exactly what we've done with sexual assault issues in Idaho with that report. We will help you. Anything that we can do to help you, I would love to do. We have made this system available. I think I've discussed it with now 16 different states or entities. I believe that about 4 or 5 are looking at either implementing our system or a very similar system in their state. They've used our system for ideas for generating their systems. We'll help you however we can. We'll make it available for download and putting it up on your servers. We'll talk to you about what we've done and the problems we've run into. It is an ASCLD initiative. You mentioned that I am the president of ASCLD this year, and we have a committee that we've established to look at kit tracking and how we can make software tools available either open source or through other methods to help states implement kit tracking in their state. We're very happy to be a part of this today and take any questions if we still have time.
Thank you, Matthew. Yeah, as you mentioned, anyone that has any questions at this time, feel free to type them in the chat pod. We have a few minutes to do so. But again, we certainly thank you for your time and appreciate you sharing information on the Idaho tracking system. Kyle Kip asks. Go ahead.
So I just see the question from Kyle. How do you support your users? We provide support to our users through several mechanisms, but we have a kit tracking administrator, and her full-time job is to answer phone calls and emails from any agency in the state that's calling. We also task her with support out of state for people that are interested in information on our kit tracking system or how we use it and those kind of things. Do you want me to keep reading the questions, or?
That's okay. Paul Bush asks, how many IT staff are you using specifically for this project?
So we have 4 IT staff that we use in the initial development. I would say we probably task one of our IT staff about once a month to make a change, a tweak, fix something in the system. It takes a couple hours maybe for them to do that. For the most part, it's totally self-sustaining from an IT perspective. It runs on our own servers, so we have literally no cost to run this system long term.
Fantastic. Shameen Hill asks if you could forward the information so she can get it to her team.
Sure. So I neglected to give my my last slide here. So you're welcome to contact me. If it's something I need to talk to you about, I'll be glad to answer your email. If not, I will forward you to the right staff member that deals with that, whether it's IT or kit tracking. But we are very willing to help you. It's been given to me from our colonel that he really wants this out there. He really wants us to help in any way possible. So anything we can do to help you, we will.
Great. And then finally, Julie Wood asks, is the kit record initiated by the hospital?
Julie, really good question. So no, we purchase, we go through the procurement process at the state level. I and the state lab we're responsible for procurement and putting those kits into the kit tracking system. And I'll go back to that. That's really, really important. It doesn't have to be the state lab, but there should be someone, in my opinion, that is responsible for purchasing, procuring, and getting those into the system initially so that you know what your intake is. If you don't know what your intake is, you're going to have multiple hospitals contributing, and you really don't know if they put in all of the kits that exist.
Great. And we have time for one more. Carol Green asks, is there just one number on the kit, or do different pieces of evidence have different identifiers? That's
a really good question. So, Carol, we have one kit tracking number. So there's a number, and then there's also a barcode on the kit. So they can either scan it if they have that ability, or they can manually enter the number, whatever works for them. And the interior of the kit, we do not track those by barcode or anything like that. They become a part of the chain of custody for the kit, definitely from law enforcement purposes, but we don't have the nurses or the law enforcement track anything internally. They're just tracking the outside of the kit. But again, the manufacturers, we've worked with them to produce the barcode and the kit tracking numbers that we need to see. We tell them what numbers to start with, and they have been phenomenal at working with us. And I'll be happy to stay on the chat pod, and I'll keep answering your questions if you have them come in so that the other presenters can present.
Fantastic. Thank you again, Matthew, for your time today and willingness to handle any and all questions that come through the pipeline. Let's see, as the slides load. Okay, here we go. Next presenter we will have is Susan Lehman. As a quick reminder, she is the program coordinator at the Portland Police Bureau. And her presentation is entitled Evidence Tracking Benefits and Considerations for Implementation. Susan?
Thank you. Good afternoon, everyone. My presentation is about the overview of what you need to think about before you enter into a contract for a kit tracking system. And then at the end, I'm going to show a few solutions that Portland Police came up with. Evidence tracking to me is a bit like juggling. You have a whole bunch of kits in transit coming from the hospital into your property room, from your property room to the crime lab. You may be shipping them out to other jurisdictions. And so there's a lot of ways those kits can be lost or mislabeled. And so hopefully we have developed some tools that you will find useful for keeping tabs on them. So whether you're designing something in-house, purchasing something off a shelf, or you have a system designed for you, when making your final decision, you're basically going to be selecting one of these platforms. And size does matter when you select a system. You want a system to grow with you, but you don't want to pay for features and storage you're not going to use. You also want to keep in mind the amount of data entry involved. Being able to push and pull data from systems will give you the most flexibility and reduce duplicate data entry. An Excel spreadsheet will give you the least amount of flexibility and the ability to report information. Features like pivot tables allow you to easily view data using a combination of fields. Spreadsheets and workbooks can easily be designed by staff. An access database or something similar allows you to use larger amounts of data, design and produce reports that can be used on a continuous basis. And Access is designed to be somewhat user-friendly. With a few tutorials, staff should be able to design a basic database and be able to produce reports. A more complex database may require some additional IT help. And lastly, a SQL or SQL database will give you the most flexibility, allowing you to push and pull data and have an infinite number of data fields and custom design reports. However, this is by far the most expensive solution, and offers require hiring a developer. For instance, Portland Police, for our SAMS database, we use a SQL database, and it's cost us over $100,000 to develop. But that is also one reason why we share it. So the first thing you need, or the second thing you need to do is determine what you need to collect. You can, and can you leverage current systems like your records management system or the crime lab system to supply some of your data? When thinking about data you want to collect, it is best to have an inclusive approach. And what I mean by that is if you think there is a reason to collect some data, maybe you should collect it. Adding data fields after a system is completed can be costly, but not using one or two fields won't affect its functionality. You will need You will need input if you need to input information into VICAP. If so, you're will the system collect the information you need and produce a specialized report to make VICAP data entry easier? Or can your system push information up into VICAP, eliminating the data entry? And think about who you're going to be reporting to, both inside your organization and outside. And don't forget that data helps with budgets and sustaining the need for personnel. So are you just going to report to the SAK grant, or are you going to report to the legislative body or to command staff within your organization? Consider all your state and local mandates. Does your state have 100% kit submission? Are your kits barcoded so they can be tracked using a scanner? And do you have to have a victim or survivor portal? And also think about any sort of mandates that are currently in legislation and how that might impact the system that you're currently selecting. And determine the installation type. In the SAK grant world, we have local law enforcement that have grant. We have statewide grantees. And so what kind of installation type do you have? Are you a statewide system? Is it just one local law enforcement system that you need to worry about? Or are you going to data share with multiple entities? And then don't forget to gather the stakeholders. State and local crime labs, any law enforcement agencies that might be affected, perhaps the Attorney General's office, and don't forget the SANE nurses. They come up with a lot of good information about what kind of data should be collected. So now I'm going to show you some solutions that Portland Police came up with. We developed an application for Apple and Android phones. So you can scan the barcode on a kit. For our jurisdiction, it will be done by the nurse when she takes that kit out of inventory. To use it, she will scan the kit and she will just simply initialize the kit. If she's using a device that is allocated to her, it will automatically put in her name, and geomapping will automatically put in the hospital in which she is in, and she will simply just scan the kit number, and then as a secondary entry she can put in a case number. However, most of the time an officer will not be on scene yet and she may not have a case number, and that's fine. She can initiate a kit without having a case number at all. Then when the officer is called to pick up the kit, he will continue by scanning it, putting it into police custody, and then again when it gets to the property room it'll be scanned, and so on and so forth. So we end up getting this chain of custody in the end that shows you exactly where the kit is and where it's been and at what date it was there. Portland takes in about 7 to 10 safe kits a week, and we spent a large amount of time tracking those kits down. Whether it was a Jane Doe kit that that is now a reporting victim, and we need to find out where that Jane Doe kit or what case number it went under. So this barcode tracking system will make it much easier to keep an eye on all the kits. And then you have to have a back-end database, and whether you're using a large investigative database like SAMS or a smaller database like we've designing for the Oregon State Police called SAMS Track, that basically just keeps track of the movement of the kit and some other information, including information that may need to be uploaded into VICAP. And that information from the SAMS, if you have the full SAMS database, you can push your information up into the state SAMS track system. And then from there, non-CJIS and non-HIPAA data is pushed out to a standalone victim portal. so there's no chance of hacking back into your original data. And again, this victim portal is anonymous. Um, Victims don't need to sign in. They just need their SafeKit number, and the representation on the side here will always be the same, and each step of the way gets colored in, goes from gray to colored as the kit moves its way through the system. And then we've included a textual representation of the kit movement on the right-hand side there. So some other things you need to consider is if notifications are required by your jurisdiction, and if they are, who is getting notified and how often. Is the kit being, are the victims being notified when the kit arrives at the property room, when it arrives at the crime lab, or when it's done? And how you can automate those notifications is something you want to consider. Additionally, you're going to want to consider installation. Who is hosting? Who is providing the funding? Servers have monthly access fees. Cell phones have data plans, although the barcode tracking system we developed can work on a Wi-Fi system, so you don't have to always have a cell connection. But who's going to provide this funding? And it's ongoing funding. This funding is just not, you have upfront funding, but there is ongoing funding that has to be considered, and who is going to pay for that, and who is going to host the system. And lastly, you need to think about training and support. Are you going to do in-person training? If you're doing a large statewide system, that might not be reasonable. We have over 200 law enforcement agencies in the state of Oregon, and it would take a long time to get around to every organization to train them. So you can do YouTube videos, you can do webinars, and who are your subject matter experts going to be? Are you just going to have one statewide subject matter expert? Are you going to do it regionally? Or are you going to try to have a subject matter expert in all your all of your larger law enforcement agencies? And I would consider any agency with over 500 personnel, you might want to consider to have a subject matter expert so they can easily and quickly get the answers they need. So, as usual, I am quick and talk very fast. So this is my contact information if you have any additional questions or you're interested in any of our projects. As always, Portland Police provides our IT solutions free of charge. So if you're interested in seeing any of these, we will go live with the statewide system for the state of Oregon this fall, and our barcode tracking system has been beta tested over the last several months and will be implemented agency-wide here in the summer. So thank you very much.
Thank you, Susan. As we did with Matthew's presentation, if anybody has any questions, feel free to type them in the chat pod. At this time, Karen Huey has asked, how do victims learn about your system, Susan?
For the victim portal, they would find that information out from the same nurse. They will be given a IP address or from the same nurse, so they can access it at any time.
Great, thank you. If there are any more questions, feel free to type them. We'll give everybody another 30 seconds or so, and if not, we can move on to Washington. Julie Woods asks, are victims given a card with the SAFE number?
We haven't worked that out yet, but I think they will be, yes.
Great. Looks like Matthew is typing. Maybe he has a question as well. Matthew asks, well, first he states that he loves the idea of the app for users to access things, but then he asks, how are you addressing security concerns with your system?
So the barcode tracking app for the phone will have, and unfortunately the IT supervisor isn't here yet, so if I get the acronyms wrong, I apologize, but it'll be an MDM with authentication of the phone. So like in many states, some small rural agencies may allow officers to use a personal phone, but they will have to, we'll have some sort of access to verify the phone number. So not everybody, even though the app itself will reside in the app stores, we will have to have your phone ID number in order for it to access the system itself.
Great. Thank you so much, Susan. Thank you for taking the time out today to tell us about SAMS and the Portland tracking system. We certainly appreciate it, and I know our attendees do as well. At this time, we will move on to Washington.
All right. Good afternoon, everyone, or good morning. It's still morning here in Seattle. My name is John Hillman. I'm an Assistant Attorney General with the Washington State Attorney General's Office. Our office was a 2017 SAK grant recipient. With me today is Nicole Minus, who's the Program Manager for the Washington State Patrol's Sexual Assault Kit Tracking System. And we're here today to talk to you about that system, which was developed by the Patrol. That's our state police. They also run our state crime lab. The tracking system that's been developed in Washington has been implemented in some parts of our state. It was just rolled out earlier this year and is still in the process of being implemented in the rest of the state. Before we get to the specifics of that system, just a little history. Washington was awarded a SAK grant in, for some reason my slides aren't forwarding, but Washington was awarded a SAK grant in October of 2017, but several years prior to that, in 2015, our state legislature enacted some legislation to start tackling Washington's backlog of sexual assault kits, which we estimate to be about 10,000 or more. We're still in the process of our SAK statewide inventory of our kits. But Washington, I'm sure like most states, did not track its sexual assault kits prior to that time. And part of the 2015 legislation required the Washington State Patrol to design a system to track all sexual assault kits in Washington State, regardless of where the kits are located or who has custody of them. That legislation also required all law enforcement agencies and hospitals or anyone in custody of a sexual assault kit to participate in the tracking system. That same legislation also required, effective July 2015, that every sexual assault kit received by law enforcement must be submitted to our state crime lab within 30 days. So theoretically, from July 2015 going forward, we shouldn't have a backlog. But as far as the tracking system itself, we're fortunate in Washington that our tracking system is legislatively funded, which means SAK funds were not used to create the system, and SAK funds are not needed to maintain and improve it going forward because our legislature has a dedicated funding source for that purpose, so we can spend our SAK money on other things. But after receiving the legislative directive, the Patrol's vision was to develop a system where every sexual assault kit is barcoded and scanned and the information uploaded to a secure website similar to what you saw in Idaho and Portland. And from there, the location of the kit can be accessed by the sexual assault survivor, law enforcement, the crime lab, and the prosecutor. And in going about to develop the system, the Patrol created an advisory committee. They solicited the participation of our statewide hospitals association, obviously law enforcement, the crime lab, victim advocacy groups, and people like that to get as much input as they could to develop a system that would benefit everyone. And the Patrol received bids for the project. ultimately selected SAK DNA as the company that would assist in developing the tracking system. Nicole Minus is the State Patrol's project manager for the tracking system. She's been involved from the start, and she's going to tell you how the tracking system works and where we are with it now. So, Nicole.
Thanks, John. So you can forward the next. Cool. All right. So just a little bit of background for SAK DNA. They're headquartered in Ottawa, Canada, and they provide a commercial off-the-shelf software product called TrackKit. SAK DNA has been providing software products and services to public safety and criminal justice clients since 2001. TrackKit tracks every SAK entered from the moment it is collected at the medical facility. Survivors have the ability to securely log in and check the status and location of their kit. The system allows medical facility staff, law enforcement officers, prosecuting attorneys, crime laboratories to log in and enter information about SAKs. Each organization has their own portal to manage their kits and users. The system will also provide reports to identify the status of kits across the state. Additionally, TrackKit will be customized to provide all required functions and features to ensure compliance to our legislation for our state. A little bit more about the benefits of the tracking system for our state. As mentioned this year, we've implemented this new system which resides in Microsoft Azure Government Cloud. The system improves tracking and availability of sexual assault information to survivors. The new system gives survivors the ability to anonymously access and track the location and status of their kit online from the time of collection through analysis at the lab to final storage location and possible destruction. Prior to this legislation, survivors had no way of knowing the location or status of their kit. This system will result in better investigations and crime prevention by empowering survivors, improving transparency, and providing better information to law enforcement. Currently, and once the system is fully implemented, the State Patrol provides IT system administration and program management. Another fact about our tracking system is because no personal identifiable information relating to the survivor is stored, a unique identifier is required to enable system use. Every kit will have a barcode that is affixed to the kit, and a card will be provided to the survivor with access information and the associated barcode number. In the next slide, John will describe the basic workflow of our tracking system.
Okay, so this slide is essentially a flow chart of kind of the life of a sexual assault kit and the various entities who are involved that have access to Washington's tracking system. Beginning in the bottom left of the screen with the SAK tracking system in the cloud there. The system presumes that every hospital has a barcoded sexual assault kit. Nicole will talk about that a little later. The state has collaborated with a manufacturer, and hopefully later in this year, every hospital in Washington will be receiving a standard sexual assault kit that's pre-barcoded. At this point in time, as I mentioned earlier, we're still in the beginning of our SAK inventory, and so during that, the patrol and local law enforcement agencies who are doing the inventory, sometimes we're able to send them a roll of barcoded stickers so that they can start barcoding the backlog kits, but Nicole can talk about that in a little bit. So starting with the hospital, when the victim of sexual assault appears there for a sexual assault exam, the medical facility has the sexual assault kit that's barcoded, and each kit has a card that has the corresponding barcode number, the URL address for the system, and a username and a passcode, and that card is given to the sexual assault survivor so she can later use it to access the tracking system and see the location of her kit, and that card should be given to her at the hospital. After the kit's collected, the hospital scans the kit, and it's in the system, and gives the card to the survivor, and the hospital also enters certain information into the system, but other than the fact that the location of the kit and whether the survivor consented to its testing, that's the only information that's available to the survivor if she accesses the system. But once the kit's scanned at the hospital, it's in the system, and those who have access to it can enter the system and see the location of the kit. Again, no personal information about the survivor is there, including her name or date of birth or anything like that. It's just the location of that kit and whether or not the survivor consented to its testing. Once the survivor enters the system, there's also information in there that provides contact information for resources for the survivor. So the system knows, who the investigating agency is. So, for example, if it's a Seattle Police Department case and the survivor accesses the system, the site will show the survivor contact information for the Seattle Police Department, contact information for victim advocacy, and other resources in the Seattle area and things like that. So after the kit's collected, the police will obviously come to the kit or come to the hospital and collect the kit. And when they take it back to their evidence room, it's scanned. They have scanners, and the system will notate that it's located in that agency's property room. They'll also enter the system and note if the kit's submitted to the crime lab for testing and when the kit's returned from the lab. The police can also enter the system and note if the kit is transported to court for trial. When the kit goes to the Washington State Patrol Crime Lab for testing, they'll obviously also scan it in that it's arrived there, and they'll scan it again when it's returned to the law enforcement agency. And lastly, the prosecutor can access the system if he or she needs to know the location of the kit. So this system was rolled out. There was a pilot project in Pierce County, which is where Tacoma, Washington is, back in February of this year. That was the first place where it was rolled out. That's one of our larger jurisdictions. And Nicole can talk about some of the things that occurred with that and the rest of the rollout.
Sure. Do you want to advance that? Thanks, John. So as I mentioned, or as we've both mentioned, barcoding the kits was probably, or trying to figure out how to do this was probably our biggest roadblock, because as Matthew mentioned, in some states do have multiple vendors that provide kits. And in our state, that was the case. There is a committee that's put together that does approve a kit that is used by probably 95% of our state. So trying to figure out how we can use one kit throughout the whole state was a big hurdle for us. So, and as we mentioned, it's key to get a unique identifier to enable the kits to be tracked. And currently, there are uncollected kits on the shelves at hospitals that do not have a barcode. So as part of our implementation, we contact all hospitals that perform sexual assault exams with the help of the Washington Hospital Association in order to provide them with what we're calling envelope kits. These envelopes contain the tracking system barcode label as well as the survivor card, as we've already talked about. At the time of collection, the nurse would take an envelope and a kit and place the barcode on the kit and give the survivor the card. And as John mentioned, the card has the URL, the barcode number, which is their username, as well as a temporary password. The envelopes are only being provided as we're rolling the system out this year. We worked with the manufacturer to include the barcode on the kit and place the card inside. And so once we've rolled the system out statewide, that's when we'll start, the manufacturer will start producing kits with all of that in there. They will also, the manufacturer itself will also have access to the system, and that's how we are initializing the kit and the associated password. We initially thought we would need a contract for the standardized kits, but instead we were able to create a Washington Administrative Code which establishes a uniform kit and allows the successful implementation of the tracking initiative. Now I'll talk a little bit about our implementation plan. This is basically it at a glance. We are doing a phased rollout. So from our pilot and previous to that, we've learned that communication was what took the longest. So that's why you're seeing 4 weeks there about to get the word out about the tracking system that is coming to your area and training information for future users in that region. We average about 2 weeks for training. Our training is live online webinar training for hospital and law enforcement staff. We also take about 1 week to do actual registration for users and send envelopes and barcode scanners if those are needed. Then following that, the next week the system goes live in that area. So here's a breakdown of our state and how we are rolling it out. As John mentioned, we did go live in Pierce County for a pilot. That's the kind of orange area there on the left. And then we are live in Area 1, and on the west side of the state is where we are at currently. So we have 5 crime labs in the state that do DNA on these kits. So we tried to break it down by crime lab regions, but we've expanded it or contracted it depending on population size. Here's another visual of our implementation and training schedule for law enforcement and medical facility staff. Each box is a different region, which includes all of the counties of that area. You can see the different tasks and their corresponding dates listed as well. For example, we're currently in the Olympia and Vancouver region, and we've completed the initial contact training and are currently on our registration week with our go live on Monday. After go live, we include a time when we anticipate any feedback and offer an optional refresher course after the users have had some time to explore the system. During the refresher course, we answer any questions or walk through any tasks the users would like to see again. This schedule has worked really well for us. If users happen to miss the training in a previous region or miss registration, they're easily accommodated into the next region's training session. One thing we've found really helpful with this implementation strategy is that we can modify our training or our registration or even our initial contact to any lessons learned or questions we've received throughout the process. The feedback we've been receiving has been really positive. The users enjoy how simple the system is, and it fits really well within their current business processes, which was really important for us. We look forward to completing our statewide rollout by the end of this year. And John, do you want to wrap up?
Yeah, so here's just a couple links. The top one is Washington State Sexual Assault Kit Tracking System. That's the patrol's website that they developed for the system, if you want to go check that out. And then for those who are interested in SAK DNA and seeing what they can do for you, their website is indicated there as well. Here's our contact information. If you have any questions of either Nicole or I, please feel free to call us or email us, and we're happy to answer any questions. I see one there already.
Yeah, thank you both for taking the time to present and share about your system. Our first question comes from Julie Woods, and she asks, if the victim loses the card they receive at the hospital, how do they get their username and passcode?
Hi, Julie. That's a great question. So the nurse and law enforcement staff are actually able to go in and reset the password if the survivor loses the card. So there is functionality in the system for that. They can contact the detective working on their case, or if they feel more comfortable going to the hospital, they can do that as well.
And then the next question we have is from Mia Ederson. She asks, what was the cost? I assume this is in reference to the system as a whole.
I actually have, I can give you a number about how much we were provided from the legislation for the project itself, including everything. We were given, it's about $2.3 million for the entire program, including the staff, the software, ongoing development, and support as well. I believe if you go to our website that's not listed on there, we do have some documents that may contain more of a breakdown of the cost if you're interested.
Great, thank you, Nicole. Kendall Stoner asks, do you give barcodes to the medical examiner offices for their kits?
So in our state, the medical examiner only actually takes swabs, and so those aren't the box sexual assault kits, and those are the only ones that we're tracking.
Yeah, for those SAK grant recipients, we are going to inventory, you know, I guess swabs that were taken at the medical examiner's office were part of our inventory, but like Nicole said, they're not in a box kit, so that they're not going to be part. I don't think they're going to be in the tracking system.
Great. And Julie Woods asks, is the victim notified of DNA hits and prosecution information through your system?
No, we do not put that information in the system.
Okay. And Matthew asks,
This is John. Sorry, this is John. You know, that's not built into the tracking system itself, and we would rely on, you know, the police agency or the prosecutor's office to notify victims of that information.
Great. Matthew asks, I may have missed it, but how many administrative support staff will you be using and for what purposes?
We have 2 staff that were funded through the legislation. One of them is me as program manager, and we have also a system administrator, both IT.
Great. And then Julie asks, what sort of status is the victim given on their kit throughout the process?
This is John Hillman. You know, obviously, as we said earlier, if the victim, you know, enters the system, he or she's just going to see, you know, the location of the kit and whether consent for testing was given. But beyond that, you know, we're relying on victim advocates or law enforcement or the prosecutor to update the survivor on the kit and the case.
Great. Well, I think that about does it for our Q&A. Again, thank you, John and Nicole, for taking the time to present. At this time, we would like to thank everyone for attending as well. We hope everyone got some valuable information out of it, and we would like to point out that all the presentation and the slides will be available on our website in the next 2 to 3 business days. For the time being, I will hand things back over to Lisa Millette, who will take everyone through our poll questions.
Thank you, Chris. I'm now going to move us to our poll questions. If everyone could take a moment to answer these poll questions, we would really appreciate your feedback. Please also rate this webinar, as this is important information that we will report back to BJA. I'll go ahead and give everyone a minute or so to answer all these questions. All right, thank you all for your participation in our poll questions. We really appreciate your feedback. I am now going to move us to our closing slide, where you will see links for our social media pages and our website. As Chris mentioned earlier, we will be archiving this presentation, and you can view all of our archived webinars under the Webinars tab from the home page of our website. I'll go ahead and leave the Adobe Room open for another few minutes to give you all some time to explore those links. Again, thank you everyone for joining us for today's webinar.